how can digital health interventions really impact the work of health workers and more broadly global health professionals?
Yeah. So I mean, that's a great question. You have to ask what are the constraints that are keeping a health worker from doing the best job that they can. So starting all the way with their training. Most health workers around the world get from anywhere from 1 to 2 days to 1 week of training before they're sent out to be the frontline doctors of their communities. And so if you can extend that period of training through enhanced digital means, whether it's sending them quizzes, reminders about the material that they learned, all the way through to workflow optimization systems. You and I use digital calendars on our daily lives. We use a Google Calendar or Outlook to keep track of what we need to do in a given day. Imagine if you had 300 people that you needed to visit this week in a particular order. Wouldn't it help you to have a digital tool that would help you prioritize and keep track of who you had visited and who you hadn't? All the way through to sending simple text message reminders, right? As human beings, we're terrible at taking our medication, at remembering when it is we had to go to the doctor or get dental checkup. But that simple text message that comes a few days in advance and maybe even the day of has been shown now time and time again to be an effective way to reduce missed appointments, to improve drug adherence and so forth. So really small, subtle digital enhancements to how we do the practice of public health and healthcare can have a significant impact.
And what should be on the radars of global development professionals maybe 3, 5, even 10 years from now? What's the next frontier for digital health?
So the new buzzword that I think people are talking about is interoperability. And it's a big word, but fundamentally it means how do these systems connect to each other? Allowing different parts of the health system to share information across common platforms, but also reducing the amount of duplicative work that the health workforce has to engage in. If a health worker involved in malaria goes to a family and finds out that a woman is pregnant, that should trigger alerts in the vaccine workers registries, in the frontline family planning and maternal and child health care workers registries. And so there's all kinds of system level integrations that's required for that to happen.
You mentioned the need to address scale as the elephant in the room earlier today, and also to address the architecture of scale. How can this be achieved in practice, do you think?
When we build a system for demonstration purposes, we do so on a shoestring budget very often because that's what we've been given. And we're often very successful at demonstrating a proof of concept. Yeah. We send messages to a few hundred people, their behavior changes, and we're very happy about that impact. But if we want to really do this at a national scale, we have to go back to the drawing board and ask ourselves, what kind of enterprise architecture is required for us to be able to do this at national scale? And I think when we talk about enterprise architecture, it's not just the technology part, but it's also the human part. What are the human resources required? What's the training required? What's the architecture required for the local cell phone tower to be able to handle 1,000 simultaneous data requests without crashing either the application or the tower server or your main server where the data is coming from? These are difficult questions, and I think part of the reason why we haven't got all the answers to these is because there are so few projects that have made it to that level of scale yet and had to really bump heads against those challenges. So hopefully we'll figure that out as we go along and maybe some of it in advance.